Medical technologies of the early 19th century differs greatly from today, although there were many differences. Many of the technology we have today derived from the early 19th century.
Many doctors of the time were inexperienced. However, doctors managed to sustain a high status of gentlemen in society. They were widely respected and often invited as a guest in a patient's home. Most doctors went through an apprenticeship and graduated with a license with barely to no experience with surgery. They merely viewed surgeries done at a lecture hall and were lectured about how to conduct specific cuts and techniques.
Many doctors conducted surgery without anesthetics. Most surgeries during this time killed as many as they healed. By the end of the 19th century, anesthetics were introduced, such as chloroform and cocaine, which made surgery painless. Also, antiseptic surgeries were introduced and enabled to perform many complicated surgeries. However, most doctors did not wash their hands, which killed most of their patients at the time by infection. Carbolic acid was then introduced and was used to wash tools during surgery, which lowered infection risk.
Many of our tools we have today come from the 19th century, such as rubber gloves, syringes, microscopes, herbalism, aspirin, spirometers, thermometers, vaccination, antiseptics, physical therapy, and the most famous, anesthetic. But there are many tools, medicines, and techniques we have abandoned.
One of these abandoned techniques in particular was bloodletting. Bloodletting is a surgical removal of blood to cure or prevent diseases. It was an ancient medical technique which originated in ancient Egypt and Greece. Although it is believed that it didn't work most of the time, it was still widely used before the development of antibiotics. It was even used on our first president, George Washington, as he was near death in an attempt to save his life, but it did not work. The proof of this technique not being able to work is most likely why it was abandoned.
Some other abandoned tools are the use of chloroform, opium, herbane, mandrake roots, and auscultation. Although many of the tools we used have been long forgotten, these tools shape important medical advances in today's medical field.
This piece of history is brought to you by Bayer. For prompt control of senile agitation, try new Bayer aspirin. Now with heroin. Heroin.